Hi folks, you're with Tacitus today at your Pushback channel, and thank you for joining this radio live stream. In this essay, I'd like to talk about so-called health studies. There's a few studies been coming out recently pushing the idea that obesity can be dealt with by drugs and surgery and that sort of thing. But there are numerous alleged studies and claims that are out there. And obesity's been a long time favourite of the activist left, and the NGO activist sort of left cabal. And I've always thought it was a sleeper issue that Big Pharma would latch on to at some point. And I'm pretty sure that all the studies we've seen, not simply now, but previously, have been backdoor funded by the big pharmaceutical sector. But there's a couple of, there's a few recent studies. Now, whenever you see studies pushed by the mainstream media, especially when they're sensational and delivered in breathless tones, and particularly where there's a certain way of delivering the information which suggests they're targeting low IQ women. That's sort of really the target that they're after there. Low IQ people generally, but particularly low IQ women, and women are in terms of the drama of it all, particularly health conscious, in a dramatic victim sort of sense. One of the interesting things is diaries that have been dug up in ancient Rome, where men have been keeping diaries. They've mentioned about how hypochondriac their wives are. They're always sick and ailing from this or that, and doctors have to come over, and special potions and medicines have to be made up. And that's 2,000 years ago. There was a diary from, or something I dug up from the early 1950s, or didn't dig up. It was on the internet, and there's a guy talking there about how hypochondriac women are, how they're always sick, how they've always got these mysterious illnesses that no doctor can ever diagnose. So this is something that big pharma's aware of, and I think they prey upon it to try and use mentally fragile women to convince them, you've really got a problem, and let's hit it with lots of drugs and surgery. And so then the woman can qualify as a victim as well, and then even make her children as victims, and then move them into the revenue stream for big pharma. But anyway, looking at the studies now, whenever there's sensational studies in the media are put out, whether it's all women are being raped, or there's a rape epidemic, there's a violence against women epidemic, there's all these sorts of things, and there's pedophile epidemics, and so on and so forth, then you can be rest assured there's a patriarchy epidemic, there's a wage gap epidemic, and the list goes on. You can be sure that it's propaganda activists that have put it together. They've been paid to produce the propaganda, and it's been unquestionably reported in the media as being fact, and delivered as a very sensational issue to the public. New studies have shown, and this sort of thing, and again, delivered in breathless tones. So let's have a look at the idea of his one study, alleged study. I mean, they haven't studied shit, but an alleged study saying that, delivered as a considered medical opinion by the experts. And again, as soon as they mention experts, you can be sure they're just talking about activists, paid activists. So that's when they say experts, they're talking about paid activists. So here's one study that's been breathlessly reported by the mainstream media, pretty much all over the world. And now, how it can get, and this is not just one news station. This is multiple news stations. Some government funded, taxpayer funded, others private, owned by different private companies. Yet they all latch onto the same story at the same time, all delivering this breathless tone, release of the info. So let's look at the study, and firstly, it's couched in vague terms, but very emotive, very propaganda laden type delivery, which means it's not a study, it's fucking propaganda. And so let's have a look at the so-called medical expert. Now, it doesn't take that much digging to find this out, and yet it's not reported in the media. Here's a black lesbian who got her degree in a third world African basket case country at some basket case university, emigrates to the United States as an adult, is immediately employed in an area which he has no expertise, or as a children's in a children's hospital, in a very politically active propaganda, known for its propaganda, and it's politically active. Lots of lesbians, lots of leftist, socially progressive views, transgender, this and so and so that. So she goes to work there. She's hired instantly. I mean, it looks like she walked off the plane or the boat straight into this fairly cozy job, and then has gone to a government department as an activist, then back to an activist hospital that's publicly funded. And so she's held up as the big authority to write about obesity and children's issues. On what basis, I can hardly imagine. But now I managed to dig up, again, it didn't take me long, dig up an interview, and there's no way she wrote the stuff that's in there. She couldn't put sentences together, anything like that. So clearly someone else has written it and put her in there, the black lesbian fronting it. Now, I've dug up some other resources, or rather alleged surveys, and found the same thing. Very lightweight, very poorly qualified people have never had to make a buck themselves out of delivering quality services to children, or anyone for that matter. Never had a real job, and these are the people that put up front. So clearly they're propagandists. So money's coming into this hospital, this alleged hospital, and they're putting together the propaganda architecture and putting the propaganda out there in tight, almost perfect coordination with the international media, clarifying conclusively that it's a prearranged thing. Okay, we want you to talk about this. We're going to release a study which will allow you to quote the study, which will then give legitimacy to your claims. Children under the age of 10 are suffering a 5 million% mortality rate due to obesity, says study, and it's that sort of thing. And so when you look at these studies, whether it be about obesity or the violence against women, gender wage gap, you're looking at a tightly coordinated propaganda campaign produced by propagandists, paid for by the globalist cabal, if you will, and put out there again to create social division and to guarantee power and revenues to the globalist cabal. You've been with Tacitus today at your Pushback channel, and thank you for listening.